Good morning and welcome to Seeking Wellness, Our Bodies Explain on WPKN 89.5 FM. I'm your host, Dr. Jennifer Pierre, your neighborhood naturopathic doctor and public health advocate, bringing you the best of what integrative medicine has to offer. We broadcast from Bridgeport, Connecticut on the fourth Saturday of every month from 9 a.m. to 10 a.m. Here on Seeking Wellness, we discuss various health topics while clarifying some misconceptions about naturopathic medicine and providing education from a clinical, holistic perspective. If you're a longtime listener, welcome back. If you're new to the party, come on in, take off your shoes, and get comfortable. If you've missed any of our past shows, please log on to our website, wpkn.org, to explore our archives and podcasts. If you missed our show last month, be sure to check it out. We had a great conversation about pharmaceuticals. So as I mentioned before, check out our website and you'll be able to hear that. Today, we're going to be talking about two topics that are very important, especially here in Connecticut. So first, we'll be talking a little bit about Naturopathic Medicine Week. And then the second part, we'll be talking about Lyme disease. And today, I'm going to have a special guest, Dr. Jaquel Patterson. So I'm going to introduce her and then we're going to have a great conversation with her. Dr. Jaquel Patterson is a naturopathic physician with over 11 years of clinical experience. She runs an integrative medical practice in Fairfield, Connecticut, with 5 other medical providers. Her focus is Lyme and other tick-borne illnesses, autoimmune conditions, allergies, and childhood development disorders. She is the current president for the American Association of Naturopathic Physicians and also serves on the board for the Connecticut Association of Naturopathic Physicians. She completed her doctoral degree in naturopathic medicine at the University of Bridgeport and has her undergraduate degree from Cornell University and her MBA in healthcare administration from Quinnipiac University. Please help me welcome Dr. Jaquel Patterson. Hi, Jaquel.
Hi, how are you? So glad for being on the show today.
Yes, thank you for coming on. I'm really excited about this. Just to give the audience a little background is Jaquel and I actually have known each other for a while. We actually went to Cornell together and interestingly enough, didn't meet there and wound up meeting here in Connecticut and both became naturopathic doctors.
But we do have some mutual friends.
Yes, we do. And I wanted to have you on, Jaquel, because one of your specialties is Lyme, and also we're talking about Naturopathic Medicine Week. So both of those things, you being the president of the AANP, I thought you'd be a perfect guest to have on. And I want you to give the audience a little bit of information about you, anything you want to share about what you do, why you do it, your specialties, and then we're going to get right into the conversation.
Sure, great. And it's so nice to be here on the radio with, on the heels of Naturopathic Medicine Week,
Yes.
which was this month. So I am, as you had mentioned, naturopathic physician. I've been practicing for over 11 years and run a integrative medical practice in Fairfield with actually 4 other naturopathic doctors, an internist and a nutritionist and a physical therapist. So I really believe in collaborative and integrative care because really to make sure all the needs of the patients we see are served in a way that's, in a collaborative model setting. So that's what we definitely have set up in our current office. And in terms of my areas of focus, I primarily see a lot of patients for Lyme disease and tick-borne infections. About 60 to 70% of our patient base is specifically for that. And the remaining is typically autoimmune conditions, allergies, as well as childhood developmental disorders, like for autism, ADHD, and also what's called PANS and PANDAS in terms of dealing with infections. So that's what my primary area of focus is. Lyme, as we know, is very common in Connecticut and in the tri-state area which we serve.
Yes, definitely. So I wanted to start out, again, since you're the president of the AANP, with talking a little bit about Naturopathic Medicine Week. So it was October 6th to 12th of this month. And during that time, many naturopathic doctors and allies had conversations about the importance of naturopathic medicine. So on this show, I've spoken about naturopathic medicine, and I've been very open about the fact that I believe in integration and how medical doctors and naturopathic doctors should be working together for the benefit of the patient. And you're demonstrating that in your practice model. So I know we share that same sentiment. But I wanted to break down the importance of getting this information out. We are in Connecticut, and in Connecticut, there are a large number of naturopathic doctors, and Connecticut has been licensed since 1922. So naturopathic medicine is not new to Connecticut. I'm just going to break down the 6 principles of naturopathic medicine, and we're going to talk about the importance of educating the public on that. The 6 principles of naturopathic medicine are: first, do no harm; identify and treat the cause; the healing power of nature; doctor's teacher, one of my favorites; treat the whole person; and prevention. What do those tenets and principles mean to you, Dr. Jaquel?
So the doctor's teacher is actually one of my favorite too. But I think this is really inculcated throughout our training as naturopathic doctors from the first day we set foot into naturopathic school. And really, I would say getting to the underlying cause of illness is really what we always have in mind when we're looking and serving patients. And it's a philosophy that we apply in terms of how we decide to deliver care. So if a patient is presenting to us with something, let's say like chronic fatigue is a pretty common thing that many patients come to naturopathic doctors for. We want to find out what is the reason behind that. A lot of times they may go to their primary care doctor, other specialist for that, and they come out with, let's say, no real quote unquote diagnosis of like thyroid conditions or some other common pieces or diagnosis is related to fatigue. And they might come to us saying they still feel tired, and what other approaches can we do? And so as a naturopathic doctor, we're going to be looking at like stress management, we're going to be looking at lifestyle, we're going to be looking at sleep. We're also going to be rolling out other lab work or, let's say, infections that may have not been considered by other providers they see. And so I think the approach is completely different in that way. And we also are able to spend a lot more time getting to the root cause of the disease when we see our patients. So first, do no harm. That's a common tenet for really any medical provider. But I think what makes us stand out differently is that we treat the whole person. We get to the root cause of disease. And also one of the big tenets is prevention and education and teaching patients and empowering them to really be part of that healthcare journey is also a big piece and role that we play in healthcare as well.
Definitely. I think that was a great breakdown of the differences and the similarities. Of course, I would say are, although many people don't know much about our education, but the similarities would be it's a 4-year medical program. And during that time, not only do we learn naturopathic modalities, so different types of natural treatments, but also conventional medicine as well. I think certain people don't realize that we do learn pharmacology. In my school and other schools, I learned minor surgery and IVs, so how to perform those. So lots of conventional medicine is taught as well. And so I think it's a great combination of the different approaches to medicine. And I think that's why we are able to serve our patients so well and being able to come at it in different ways. And I stress that the difference is many times in the treatment, and we turn to pharmaceuticals as a last resort.
And that's a good point, I think, in terms of the training, that our medical training in terms of hours within specific areas, let's say anatomy, physiology, biochemistry, are commensurate with what is seen in a conventional medical school. And I think people aren't aware of that. And also going into naturopathic medical school, you have to complete all the pre-medical requirements. And during the time that we're in school, we also complete 2 license exams. So we have 2 license board exams that must be completed in order to become a licensed naturopathic physician in the state. And so in Connecticut, we do have that ability because it is a licensed state to diagnose and treat. But Connecticut is also, has had its law in effect for one of the oldest laws actually in the United States in terms of having naturopathic medicine as a licensed modality to see a provider within the state of Connecticut.
And can you talk a little bit about where we are? So first, the fact that every state isn't licensed, just briefly talk a little bit about that. And then also where we are as far as our scope of practice in Connecticut, because I always tell patients that they're very fortunate in Connecticut that you can see a naturopathic doctor, and it's even covered by insurance for many plans. So could you talk a little bit about that?
Yes, it's true. We are very fortunate because there are only currently 22 licensed states for naturopathic medicine. So there are 6 actually accredited naturopathic medical schools that are approved by the U.S. Department of Education. And actually, the good thing is I'm on the Connecticut board for naturopathic physician. I'm also on the national president. So I have both, landscapes. But so there are 22 states licensed. We do, in the past, 3 years, we have had, 4 states that have been licensed, 2 of which are actually close to Connecticut, Massachusetts, and Rhode Island. So we are making really good headway. Each state, though, does, the goal is to have all 50 states licensed so that we can also have also the scopes being consistent throughout all the states. So depending on the state you're in, the scope may be different. So as I mentioned, Connecticut is one of the older scopes, but also one of the laws that haven't been updated in a long period of time. So as naturopathic doctors, when we get trained in school, we do learn, like Dr. Pierre had mentioned, pharmacology. We're experts in drug-herb interaction, and we are trained to prescribe, and we can do so in states like Vermont, which would be the closest state, in Arizona, in Oregon, in Washington. A lot of those scopes can do that, as well as things like prolotherapy and injections and intravenous of things like, B vitamins and glutathione. And that scope is what we're actually trained in. However, the state of Connecticut, their scope is more limited, where we can diagnose and treat, but we aren't allowed to do things like prescribing, even though we're trained to do so. So one of the pieces that we have been really pushing in our scope within the state really for the last decade is to be able to have limited prescriptive rights. And the reason being is to just be able to provide a greater level of care for our patients. That's not our first go-to is to have a prescription, but we do have patients, let's say if there's an acute infection or something like that, that we might want to prescribe immediately. And then also, there are also patients that we're really managing their care and might be on, let's say, thyroid medication for the last 20 years, and their medication hasn't changed. And they only want to see a naturopathic doctor to manage their care. That's a lot of patients I see.
Yes.
So having it that they have to go back and forth between multiple providers to do so is actually cost in the system in terms of healthcare costs. And it creates a coordination issue and challenge for patients in terms of seeing multiple providers when oftentimes they want to have one, particularly a naturopathic doctor, manage the bulk of their care.
Yeah, I find the same situation in practice because many patients I see have had not so good experiences with conventional medicine, and they would like that management of care, and the back and forth, like you said, it does waste money because it's not necessary. And again, I like that you stressed that point. It's not the first thing we turn to, but sometimes it is necessary. And I had that discussion last month when we were talking about pharmaceuticals with Dr. Christina Wright. We were talking about the fact that pharmaceuticals are not the devil, and every naturopathic doctor doesn't believe that. It's just about finding ways to prevent side effects and using medication when necessary. And some people say, well, if you're natural, why do you need medication? But it's for those reasons exactly. And I've also found a lot of medication errors with my patients and polypharmacy. So having that prescriptive right would be helpful in Connecticut. But I tell people all the time I can do a lot without it because that's what we were trained to do.
Yes, and also from the safety perspective, a lot of the patients, and I'm sure the same with you, see is that they'll start getting better with our protocols, and now they might need to, let's say, reduce their medication because they're doing so well. And so now we have to coordinate that out with their PCP because we can't take them off their medication. So there has to be that care coordination of how it gets dropped down. And so being able to prescribe, for example, we would have the ability to kind of titrate and work with that patient as they're getting better. And so it creates a lot of kind of waste, I think, in the system. And like you said, when it's necessary, we do think it's necessary. And I definitely have had that. And that's the great thing with our office. We do have an internist. I have built, strong networks in terms of specialties, doctors' offices. So I can work and coordinate with them when we feel a patient needs, let's say, a higher intervention or further workup. So that is also all part of our training is what that, what's at the safety for the patient based on what they're coming in with.
Great point. And I think that, like I mentioned before, is a great perspective of working with an internist, a medical doctor, and seeing how it can be beneficial. One of the things that I, bring attention to in Naturopathic Medicine Week is, again, how we all should be working together for the benefit of the patient. And I think the topic that we're going to be talking about today, Lyme disease, is a perfect example of how that can happen. So we're going to transition into talking about Lyme disease because, again, that is definitely important in Connecticut. After all, the disease was named after Lyme, Connecticut in 1975. So I want to transition to talking about Lyme disease now. And that's one of the things that you treat, one of the diseases. And I wanted you to give us just some background on that and what the listeners should know about Lyme disease, being that it's so relevant here in Connecticut.
Yes, and that's the interesting thing is that it's started here, yet a lot of people, there's some misinformation about diagnosis. It's also known, Lyme disease is called the great imitator. So our focus is Lyme disease because of the fact that it imitates a lot of other different conditions, particularly autoimmune conditions. So that should always be in part of the workup as well. But Lyme disease was found, in the 70s in old Lyme, Connecticut, as Dr. Pierre had mentioned. And what happened where there were kids that were having, at the time, these arthritic symptoms, which were kind of diagnosed and looked at as juvenile arthritis. And so later there was obviously more research by Dr. William Bergdorferi, and identified this tick-borne illness, which was related to these manifestations that these children were having. And so the most common piece, it's also known, it's commonly called Lyme disease, but known as Borrelia burgdorferi, and it's from a deer. It's called a black-legged deer tick. Well, the most common manifestations that people are aware of is the bullseye rash, and which is also known as it's called erythema migrans. So a good amount of people have, I'd say about 50% of people may have a bullseye rash, but a lot of people actually don't. They might just have a rash, or they might also have it in a location that they cannot see it. And so oftentimes, unfortunately, some of the patients we get, they are diagnosed with it and they may have had it some time ago. But the best and ideal case for Lyme disease is if you do have the bullseye rash and you treat immediately, because that's the time in which you get the best result. So oftentimes people do not get that until a little bit later. And a lot of the symptoms, the initial part of having Lyme disease include bullseye. Also fevers are another common pieces of undulating fevers, as well as like shakes and chills. And also people will get swollen joints as a common piece, typically in the knees. They'll get a lot of swelling. So those are typical symptoms, like initially is the fevers, the headaches, the chills, the bullseye rash, the classic bullseye rash. And then sometimes swelling, people will get swelling like in their knee capsules specifically. And so in those cases, especially with the bullseye, if you have it immediately, the first form of treatment is is typically an antibiotic. Doxycycline is the most commonly known. For children, if they're under the age of 8 years old, they would do amoxicillin. And typically it's doxycycline for 21 days. And that's if, like I had said, if those immediate symptoms are found, which unfortunately a lot of people do not get that till later. The other challenge is when you run blood work for Lyme disease, and if you have those immediate symptoms, it takes typically around 4 to 6 weeks sometimes for the antibodies to become elevated in your body. Meaning if you do have something like a bullseye or rash and you complete lab work right away for Lyme, it may actually not be positive at that time because your antibodies have not risen by the time the blood work is taken. So oftentimes, if that skin manifestation is present and you see a doctor, they may just prophylactically prescribe the doxycycline and retest later. However, the antibiotic can also, get those antibodies to go down as well. So there's a lot of information as it pertains to Lyme disease, as it pertains to the lab work, and also the symptom criteria.
Which is why we're doing this show, because this kind of education is what people need to know, being in a place where Lyme is so prevalent. I wanted to back up a little bit and talk about the ticks and the idea of tick-borne illness and what can be done as far as prevention and even just being aware of ticks and how to identify them. If you could give us a bit more information about the ticks in general and how they're carrying this bacteria and how that's actually transmitted to the host.
Yes, and when I work with patients, that's really the most important thing for the future is what do we do for prevention? Because obviously prevention is always, and lifestyle is always better than taking a medication or even supplements. It's a lot better to be able to prevent it from happening. So typically, you want to be mindful, especially if you're going outside and hiking or if you're very active outside in the environment. You want to make sure you have long pants, socks, things that will actually cover you fully, a hat to protect you also from the sun. But oftentimes the ticks will get into your scalp, and that's an area where people often do not see it because you're not especially if you have long hair, you're not necessarily seeing that if there was even a rash manifestation on your scalp itself because it landed on your head. So making sure you have coverage in terms of a cap. And then what I'll tell people, there's also sprays. So we use in our office a spray that's Pickardin, which is comparable, shown to be as effective and has been approved by the FDA for equivalent effectiveness of a product like DEET. But it is odorless, so that's a great thing, and still is just as effective. There's also essential oils people use for mosquitoes and for ticks. The most studied and shown to be effective is eucalyptus oil. Some other people will use like lemongrass and lavender. Those are some other oils to place on yourself as you're going outside. The other thing I'll tell people is to make sure as soon as they get back inside the house, if they're outside, is to make sure that they do a body scan and check their body fully for potentially having ticks. So they can hide in like the groin area. Ticks will stay on your body for up to 48 hours.
Wow.
It can take up to, a lot of people don't know that. It can take up to 36 to 48 hours before it's transmitted. So oftentimes if you're getting it within the less than, let's say, 6 hour, 12 hour time frame, you could be okay. And so if people do find a tick, what we'll say is to remove it carefully. There's actually tools out there that you can get online to remove a tick. And I'll also tell them to put it in like a Ziploc bag, because you can have that test actually sent out to get tested to see if it has Lyme disease. So that's one of the most definitive is actually testing the tick itself. So if people do see it, I'll tell them to remove it, put it in a plastic bag. A lot of the city departments of health will actually check for specific strains, and then some people send it out to other lab vendors. But you can also look at your Department of Health in your city to actually check the tick to see if it has Lyme disease. So that's one thing if you do find it on you. But usually it gets transmitted after it's staying on your body for a period of time of like I said, it could be up to 48 hours, but typically it's like between the 12 to 48 hour time frame. And the other thing we'll tell people when they come in the house to check themselves, and then also to take a shower if you've been out in nature, because that's another way to rinse anything off. So those are typically the best ways in terms of prevention. I really, really think it's important to go out in nature and to be active. There's a whole mind-body component of that, being outside, at least 20 minutes a day. I do have a lot of patients that have had Lyme disease infections several times, and they're so nervous to go outside in the grass, and are, continually worried about that.
Which is understandable.
That's not good either. So
how difficult is it? Oh, sorry. Go ahead. I was going to ask you, how difficult is it to remove the ticks?
It's not. You just want to make sure you try to get the full legs to come with it, and to be really careful. Some people will just pull it off, really quickly, but you want to make sure. That's why it's good to get those tools where you can actually pull it off slowly out of the skin. But it's actually not that difficult. It's a little hard if it's very burrowed in your skin, but you just have to do it, slowly. And then oftentimes too, another source of getting ticks is also through pets. So a lot of people have dogs and cats, and dogs are outside on the grass, and also dogs are in dog parks with other, dogs that have those ticks. And so when they come in the house too, it's really important to check. And a lot of our patients will say, oh yeah, I constantly find ticks on my dog all the time. So you have to be careful, because a lot of people keep their dogs in their beds, their dogs are on rugs, and carpets, things like that have ticks. And so you also have to be mindful of, even for your pets, not even just for yourself, because they often carry those back into the home.
I'd like you to mention the name of the spray again that is important for people to use, that you said that's
yes, so it's called Picardin, Picardin, and it's actually made from the same plant family as black pepper. And that one has been approved federally, so in terms of its effectiveness.
And can you use that on pets?
The other ones are essential oils like eucalyptus oil.
Can you use that on pets?
Yes, you can use it for pets too.
Oh, perfect.
The odd thing is, though, most of them are odorless. So I think, unfortunately, we're so used to using like DEET and those really smelly products that we tend to not think, tend to not think it's as strong and might use more than necessary, but because it is an odorless product. The other thing people use when they're outside so it can't stick on are like oils like Skin So Soft and things like that are on the skin, so it's harder for it to kind of adhere and stick onto the skin as well.
Okay, that's great information. I wanted to talk a little bit about the stages. So we mentioned before how there are these symptoms, and as we know, those symptoms look like lots of different things. But what are some of the things that you've noticed in some of your patients who have come to you in early stages of Lyme disease versus latter stages? Like, what have you seen in comparison?
Ideally, I get the pace. The ideal way is within those first few months of transmission. So you have what's called IgM. When you're getting blood work, oftentimes the doctors will do what's called a Lyme ELISA test. And most of them, this is one thing for people to know when you're getting tested for Lyme. It's about 50% false negative. So if you do get tested, 50% of those test results will actually be false negative. So you may have it and it came out negative on the test results. So that's one piece that's important to check. So after that, sometimes if it's positive, they'll do what's called the Lyme Western blot, which is for both acute infection and then also for a past infection. So in our office, we often check for the Lyme Western blot because it shows a lot more information on the bands. There's specific bands that are presented with Lyme disease. And so in the early phases, you would have what's called IgM, which is an acute infection, and that's typically any infection within the last 3 months. And then once it goes over like 6 months and past, there's what's called IgG, which is meaning that you had, a tick-borne infection in the past. When it's IgM, which is the acute infection, it's typically the easiest to treat. And if you do have those, like I had mentioned before, those skin manifestations, that is the time to do like the doxycycline. The best, the standard conventional treatment is 21 days, but ideally someone is on doxycycline for, let's say, 30 days. And the reason being, if you do get prescribed it, is that the ticks Lyme actually takes about 14 days to replicate, 13 or 14 days to replicate itself. So some people are given, let's say, doxycycline for 2 weeks, and it's pretty much a waste because the Lyme is just about to replicate or just re-replicated, and you only took it for 2 weeks. So that's why generally it's better at the 4-week time frame for that reason, due to its replication. Most people, if they do have the skin manifestation and they get doxycycline right away, most of those symptoms will all go away. So that's the best case scenario. But the patients that often see me are typically after they've done doxycycline and they're still feeling, the most common symptom is fatigue. Like, I'm still feeling completely exhausted. And I know this has to be from a tick-borne infection because I never felt this tired before. Or I'm having, the fatigue is a big one, or I'm having a lot of random body pain. Lyme disease is one of the only conditions that has migratory joint pain. So you'll have pain on your arm and then it goes to your knee the next day, and they'll come to me saying, like, I feel like I'm going crazy, going crazy because it doesn't make sense. Why am I getting these pains all over my body? And so those are the most common things, like, after, that people might say they're still having after they've been on antibiotics. And that's where I've found that herbal medicine and treatment has worked really well, because a lot of what we do is all on immune modulation, down-regulating some of that pain relief, but then also doing something for those spirochetes. So some of the patients we've also seen have been on antibiotics for 3 years before they've come to see us, and they're still not feeling well. That always concerns me if you're on antibiotics for months and months, because it does affect the gut microbiome. As you know, Dr.
I was going to bring that up.
Immune function and everything else, and they'll be more prone to infections after and getting sicker later. And so there's so many ramifications of being on antibiotics for a long period of time. So that's just one thing for the listeners, is that's not the only solution. A lot of the patients come to me feeling like they had what I had mentioned, IgG, an infection from Lyme a while ago, and they're still having all these symptoms, and the only resource for them is to do antibiotics forever, and it's not. And a lot of them don't feel better. I mean, they feel a little bit better, but we often get people off of those antibiotics, or they have much better success doing, herbal protocols. So going back to your question, the most recent infection in the last 3 months that's the early phase 1 of Lyme disease. And then phase 2 is really when it gets into 6 months and past, and you have what's called chronic Lyme disease. There's a lot of controversy over that, with some doctors, of, if that exists, or is this really chronic? And they're also called persister. It's called persister disease, chronic persister Lyme disease, where they're still not getting better. But I have seen people, when we put them on the Lyme protocol, get completely better. So to say that it doesn't exist chronically, I think is not correct, because I've definitely seen it in practice and have seen people get better.
And why do you think there is this belief? A lot of patients I've seen have mentioned this sentiment of some medical doctors saying that it doesn't exist, or Lyme disease is made up. What do you think is really behind that?
I think one thing is, when they do test the ELISA, which I said is that 50% are false negatives. So what happens is they go in, they think they might have it, and then it's false negative, and it's just kind of written off, and they're still not feeling well, and there's been no recommendation for them. So they walk away being like, I still have fatigue, I have neurological symptoms, people have dizziness. Also sometimes with some other co-infections like Babesia, they might have shortness of breath or anxiety and these other types of symptoms, and the patients will come saying, firstly, it might have been negative, or it was positive, but it might be IgG. So they might just be told, this was from before, there's nothing to worry about. And it's not true, because they're still having the symptoms. And then oftentimes the challenge with Lyme disease is there's so many different manifestations. A person might have, like I mentioned, dizziness, neurological symptoms, coordination issues. They might have fatigue. They might have migratory joint pain. They might have anxiety. They might have palpitations. So those symptoms all seem completely random. And so sometimes when a person is going to the doctor, they might be told kind of it's in their head. And there's a saying like, well, it is in your head. It could have went to your head in terms of affecting your brain. But But that's the hard part, especially my patients I find that are in like their 20s or 30s that were completely healthy. They might go and are told, it's in their head, because they might present to a doctor as being really anxious, or this is just anxiety. And so we have patients that have been giving like psychotropic medications, like Paxil and, all kinds of medications. And like, I still feel exactly the same. This is like, I've been doing it for 3 months. They said this is because of anxiety, but I'm still having all these symptoms. So oftentimes, especially people I find that are younger, they often get told, that this is anxiety, because some of the symptoms can seem like that. And also with Lyme disease, it is, like I said, the great imitator. So it kind of mimics many different disease conditions, including things like people that are having anxiety or panic attack. And so it gets not really looked at as that way. And then the other thing is, Lyme disease is also, per CDC, is a clinical diagnosis. It's not just by the lab test. The lab test is something to help confirm it, but per the CDC, it's a clinical diagnosis. So you need to make sure, if you are working with a provider and you're not sure, or you're still not feeling well, to look to work with somebody that has some expertise in that area, where you can ask these questions and make sure it's worked up fully.
And I'm happy you mentioned the CDC, because this is a public health issue. And it's important that doctors are informed about this and actually acknowledge it, because it's happening and it's very common, especially in the tri-state area. So it's important that you mention that about the CDC and how it affects all physicians and all practitioners, just to have that awareness of it. I wanted to ask you to speak a little bit more about some of the co-infections. You mentioned Babesia, there's Bartonella, and some of these names that people have probably heard. If you can just talk a little bit about that.
Oh, yes. So they have different manifestations too. So Babesia is one. It's another tick-borne infection. So lots of times with Lyme disease, people will often have what's called co-infections. And the common co-infections, particularly in this area, and they're basically other tick-borne infections, but also a tick can carry more than one strain. So you might get bit by a tick. It might be carrying Lyme disease and Babesia, or a tick could be carrying Lyme disease and Bartonella. So many of the patients we see have what we call these co-infections. So Babesia is another tick-borne infection, and the most common symptoms for that includes like fever, shortness of breath, sometimes chills, night sweats. I actually myself had Lyme disease and Babesia, and at the time had those symptoms of like totally drenched, almost like felt like I was having hot flashes.
Wow.
And at the time, they thought exactly what all the patients have, that this is anxiety. And I never had that ever in my life. I mean, I definitely had suffered some from anxiety, but I never had it where I was like completely drenched constantly from doing nothing. And so Babesia commonly will have that. They'll have headaches too as well. And the fevers are a common thing. And the other thing, common infection, is Bartonella, which is also known as cat scratch disease. And Bartonella is one of the trickier ones, because that typically will affect more the neurological symptoms. So people will say, oh, I have brain fog, which you could also get with Lyme disease, or memory issues, or which typically is the hardest for my patients that are like under 50, because they're like, I shouldn't have memory issues or brain fog below 50. Like, I feel out of it. Or they'll have dizziness. They'll get sometimes neuropathy with Bartonella.
Tell people what neuropathy
muscle coordination issues too.
Tell people what neuropathy is if they're not familiar.
Oh, I'm sorry. So neuropathy is nerve pain. So a person might get nerve sensation in like their feet, or numbness. I've had several patients with Bartonella. One common, I feel like I should research this, but one common thing is their feet. They'll say like, I have feet pain or feet sensation as soon as I hit my feet down from the bed in the morning. It's like numb, or they have like lack of sensation or feeling. And that's actually one of the cool things when I see people get better. I'll mention, oh, how are your feet when you get up? And they're like, oh, I forgot. It's fine. I'm not having that anymore, because you forget about that. But before they were dealing with it every day, that as soon as they put their feet down on the ground, it was kind of like there was a lack of sensation. The other thing people can get with Lyme disease, well, Bartonella, like I said, has more neurological manifestations. But with Lyme disease, some people in terms of neurological might get Bell's palsy. It's also connected with that. And Bell's palsy is when you have like a issue with the muscle weakness on one side of your face. And we have I have seen cases of that. Typically they'll happen like very early in the transmission of when they first get Lyme disease. So Bell's palsy is considered a neurological factor, which causes like muscle paralysis on one side of the face.
And Bell's palsy, that's great that you mentioned it, because many people, it comes on very suddenly for lots of different people when they have it. And it may get confusing to understand whether it's a sole issue on its own or it could be connected with Lyme.
Exactly.
And it's very shocking to people when they do get it. I treat some patients with Bell's palsy with acupuncture, and that can be helpful. And I think that's the way we can integrate some of the naturopathic tools along with the protocol, the antibiotics, and then following up with some of the other things that we know how to do that can help with these issues that the patient is dealing with. How do you support your patients psychologically when they're dealing with all of this and they're told it's in their heads? And how do you approach that with your patients?
Yes, that's a good question, because that's part of the process too, is that for some of the patients, they have these symptoms of anxiety or depression as a result of this, this tick-borne, like it actually caused it. I've had patients that are like, I've never had this before. One of the reasons is because it causes inflammation towards the brain, and so that can disrupt the normal flow of like your neurotransmitters. So some people have that, but then we also have, it's like that tricky balance, because also people have anxiety and depression because they're not feeling well, and they're like, I'm feeling like I'm quote unquote going crazy. I don't feel well. I have all these symptoms, and how long is this going to last? Am I going to have this forever? Is the rest of my life going to be like this? So there are also that piece of it as well, or a person that will start getting well that I see and they're doing well, and then 6 months later they might get a little flare, and then they get really anxious that, oh my gosh, is everything going to come back again? And so you have to work with the patient on that and kind of walking them through the steps. So for example, if there's some anxiety due to this condition, we'll go through all the symptoms, like, oh, well, how many headaches have you had in the week? Well, it's only been once, when I'm working with someone, let's say in the first 3 months, I'm getting one in a week. Well, remember before you had them all day, every day. So going through that list of symptoms and how they've decreased, or, oh, how are your body pains? Or, oh, it's only happening, I might feel something every 2 weeks. Well, remember before you were having every day. So I think reminding people of their progress that they've had since working with them and since their illness are all those like reaffirming the fact that they're getting better is really important. And then some of it is, so it's that whole mind, that connection of like reaffirming, also doing things actually to support their anxiety, like what brings them joy, we go through, and what are the things to ground them. So making sure they're building that into their base as well. And then for some, they may need adrenal gland support because they totally tax their adrenal glands from stress from the disease condition or from the disease. And then also, we might actually give supplementation to support anxiety and depression specifically, if they are having it and it's not starting to get ameliorated from doing the Lyme protocol. Lots of times I'll see it starts getting better anyway from doing the protocol without having to do any type of intervention with supplements for anxiety, for example.
And you mentioned earlier about autoimmune diseases. I wanted you to talk about autoimmune diseases and other differential diagnosis that comes up when we're talking about Lyme disease. As you mentioned, it's the great imitator. And autoimmune diseases are also rising in the populations. I know that we both see. I also treat autoimmune diseases. So I want to talk a little bit about what some of those autoimmune diseases are and how they can possibly present with Lyme, and how you separate out some of the diagnosis, and also how sometimes they actually work together, so to speak. And that's not the most beneficial thing, of course, for the patient, but how you deal and manage with other diseases that may coincide with it, like we mentioned before, thyroid disorders and things like that.
And some people can have, you could have both. You might have Lyme disease and another condition going on. And so I think that's one of the challenges too is that even though I had said over half of my patient population is Lyme disease, and a lot of that's because of word of mouth, is because of, you don't want to also think, one of the challenges, you don't want to always think everything is Lyme too.
Yeah.
So you want to make sure, because that could happen sometimes if you do go to a Lyme litter expert where they're only looking in that paradigm. And I think as a doctor, just any doctor you go, and I think Dr. Pierre is similar, that you want to make sure you're seeing a doctor that's like just open to what are all the possibilities instead of getting pigeonholed into one thing. So we always make sure we're checking like a full autoimmune panel, because a lot of those symptoms might be like, let's say, chronic pain and fatigue, or joint pain and fatigue. Those are common symptoms for other autoimmune conditions like a rheumatoid arthritis. Lupus is another one. Those are two that come up pretty frequently, or something. Yeah, usually rheumatoid arthritis, because like an osteoarthritis is typically over time. So we'll see like a rheumatoid arthritis or lupus is one of the pieces you want to rule out. And we'll also do the test for things like ANA, which is anti-nuclear antibody, which you look for lupus. Rheumatoid factor is another one you use for rheumatoid arthritis. You also want to look at the inflammatory markers in your lab work called ESR and CRP. Those are two inflammatory markers they should also be checking with. So we use one comprehensive lab testing that checks for like 32 autoimmune markers just to rule out everything. And I have had some people, I'd say, that have had seeming like the picture is more actually lupus than Lyme disease. And as that case, I might actually refer to a rheumatologist to get a full workup and diagnosis, and then we work with them. But also, I'll see about 25% of patients, normal people have an ANA that's positive. So that's one other piece to know. But also other infections like Lyme disease, Epstein-Barr, just infections in general, cytomegalovirus, those can also increase up other antibodies. So I'll see somebody that has Lyme, and they also might have a positive ANA, but it's only like just met the mark, like 140, 1/40 or something like that. And that could be because those infections are lifting up some of those other antibodies in your body. So you have to kind of keep all of that in mind, depending on like how high of a positive it is, or what are the other symptoms that you have. So each disease condition, like something like lupus, has different criteria, like a butterfly rash or ulcers in the mouth, or they still have the joint pain and fatigue, but it might also have issues with their white blood cell count going lower, or they might have kidney issues. So those are all the pieces you want to make sure your doctor is looking at and ruling out. But I will say on the other side, I have had people that have lupus and have had, we find a diagnosis of Lyme and we start treating them with Lyme, and their symptoms of their autoimmune condition start getting better. In addition, like what you just said with thyroid, like we have a lot of patients that have Hashimoto's, which is an autoimmune condition of the thyroid gland. And they also have a diagnosis, like new diagnosis of Lyme. I start putting on the protocol, and I'll see their like thyroid, their markers start getting better too. And I think the reason why is because there's less infections in their body, they're less inflamed, and there is something out there what's also called, if you research, is called molecular mimicry, which also it can increase up. I'm trying not to become too scientific with it, but it can increase up some of those antibodies related to these autoimmune conditions that people are having. So lots of times when you work on those infections, like a Lyme disease and other tick-borne infections, you'll see some of those symptoms get better as well.
That's great information to share, because as I mentioned before, autoimmune diseases are on the rise, and there are even autoimmune diseases that we don't have names for. So in naturopathic medicine, a lot of times as we're looking at a patient, we're talking a lot about inflammation. And you mentioned those markers that are important to check, like sedimentation rate, CRP that become elevated. I know that in the past there was a Lyme vaccine and it was taken off the market. As far as moving forward, is there any other move towards creating some sort of vaccine, and how do you feel about that?
Yes, I know it didn't work well in terms of the outcomes from it, but they were looking to do it for animals. The other piece that they're now looking at researching is using it for mice because mice are the common carriers. Deer
Yes.
is obviously another one, but one of the other pieces is mice because they're in the woods or around the area in terms of carrying ticks. So one of the pieces has been doing more work on the mice itself. So with those, like, let's say vaccinations, so that there's less basically ability to carry it for, for us humans, like going out in the woods and things like that. So that's one other piece that's being looked at, as well as preventatively. But I think as much as you can do is the prevention steps that I talked about earlier. And if you do have a suspicion, is definitely trying to get tested right away, but just also being mindful to be open that if you're still not doing well and it's been a period of time and all those other pieces we rolled out, like autoimmune conditions or, other symptoms have been, that you do potentially look at, like, go to an expert in infectious disease or a Lyme expert or somebody that is going to be looking at it with a different angle if it's been several months and you're still not doing well.
And what would you like to leave the audience with as far as if they think they have Lyme disease or they've been dealing with Lyme disease, what are some thoughts that you'd like to share with them, kind of take home messages from this conversation that we've had today?
So if you do think, make sure you do see, based on all the symptoms you have, there's actually a lot of assessments out there that will kind of see if you have these, like, let's say 10 symptoms that they fit into the category of Lyme. So I think speaking up and advocating for yourself is really important. I think that's really hard for people to do. And I think that's what I think in terms of, we pride ourselves in our practice, and I think a lot of naturopathic doctors would be, I think because we have time, we spend so much time with people, half an hour to an hour, people can really speak up and ask questions. So definitely write your questions down and come in and speak to those things with the doctor you have. We have very specific herbal protocols, two of which I didn't actually go into so much, but andrographis is an herb that's been studied and used as the most commonly studied herb for Lyme disease. But two of them that we use, Uncaria, which is also known as cat's claw, which is an immune modulator, and Otoba, which is basically a South American herb. Those two have actually been studied at University of New Haven and shown to be more effective, as effective, if not more effective than doxycycline and the antibiotics. So we employ these, like, specific herbal protocols that have been, time tested and have also had shown clinical efficacy for the patients we see. So with the patients, you want to make sure that if you feel that you fit in the category, that you ask these questions to your doctor. You look at these herbal protocols. I mentioned a few, andrographis, Uncaria, as well as Otoba. Those two herbs have been studied. And then there's also a lot of dietary things people can do. So typically we'll look at, like, more of an alkaline diet. And then there's another diet called, like, autoimmune paleo diet, in terms of looking at foods that are less inflammatory. And a lot of our patients, like, will get, 40 or 50% better just from making those dietary and lifestyle changes. And when they change them, they don't feel as well. The most two common ones are typically gluten and dairy. So looking at those pieces in terms of diet is another first start when you're looking at getting well.
Fantastic. Thank you for sharing that. So give the audience some information on how they can contact you on social media, your website.
Yeah, so our website, so we're based in Fairfield, Connecticut. The website is fairfieldfamilyhealth.com. And we're also on all the social media slugs at Fairfield Family Health on Instagram as well as Facebook. And then I have my personal tags as well, which is at Dr. Jaquel, DOCTOR, Jaquel, JAQUEL. That's on Instagram as well as Facebook. So we also at our office offer 10-minute complimentary consults. So if you do feel you might fit into this category, you can always give us a call at our office, which is 203-254-9957. And we can offer that, so we could go through, what would be the approach for working with you, and also even going through both the herbal and nutritional approach as well.
Thank you so much, Dr. Jaquel, for being with us today. I am eternally grateful for you being here. And I'm biased towards fellow Cornellians. So I'm happy that you were able to be here and we can have this informative conversation. It's fantastic. And I can't wait for people to hear this if they're not listening to the show today, to check out this information because it's extremely relevant. So thanks
And
again
I'm
for
so
being
great you have
on.
this show and information for people to just learn and get information. I think knowledge is power, and I think you're doing the doctor's teacher fully by having this show. So I really appreciate you having me on, and know that this is really helpful for the community we're in.
All right. Well, thank you everyone for tuning in today. Please be sure to check out our website, wpcan.org, for our past shows and meet us right back here, same time, same place next month on the fourth Saturday of the month. Enjoy your weekend and stay healthy.